Special Care number 5, Apple Calm, holds a rather important position in the care programme. Although we've been discussing the programme as 1 through to 7 formulas, Apple Calm is often used uniquely on its own to begin the programme, and it's in a situation where there is extreme hyperactivity, extreme conditions of maybe fitting or serious pain, where children are very, very traumatized at the beginning of the program. Fitting is extremely important to deal with, because actually fitting can cause serious problems and blocks and holds back the progress of recovery. So it would be at this stage that this program would not start with Olive Love number 1, but would start with Apple Calm. I'm very experienced with taking care of autistic and special needs children, and the children who fit are often on, they're on a danger level, because fitting can be so serious and it can hold back the recovery process quite substantially. There are many causes of fitting, but it does need to be addressed. The truth of the matter is that there are very many chemicals in the environment and in life today, and these chemicals which cause fitting and cause hyperactivity are often quite well known. For a start, one of the most aggressive chemicals in modern society, which does seriously aggravate hyperactivity, is aspartame. E-additives, petrochemicals, petrol fumes. There are many drugs as well that excite and irritate and inflame the nervous system. Steroids, cortisone, cortisol, epidural is a procedure that's used in many, many cases now. There's very little known about the long-term effects of epidural on the baby. All our research has shown that the epidural drug is very irritating and disturbing. It paralyzes the first cervical vertebra, causing quite a complicated issue between the axis of the skull, the atlas, and the top of the brain. The spinal cord, the spinal fluid, and of course the choroid plexus. The choroid plexus is a very complex part of the brain, and it's responsible for producing spinal fluid. When epidural is administered to the mother at the beginning of birth, unfortunately, this drug does pass through the placental barrier and causes inflammation and irritation in the baby. It's a well-known fact that epidural side effects, which are listed, and they're quite numerous, one of them is this excitation of the nervous system, quite serious excitation of the nervous system. But that doesn't just link with the mother who's had the epidural, does also occur in the baby. I honestly believe that some of these chemical drugs, such as epidural, and there's another one, unfortunately, which is the oxytocin induction drug, prostaglandin, that also can cause quite serious problems with that part of the brain. A rather eminent doctor, specialist, called, his name has just gone straight out of my head for the moment. It'll come back to me in a minute. But he's actually made some pretty important research. Michel Odent is the specialist I'm referring to, and has written some very important books about the effects of oxytocin and also epidural on a very important hormone called oxytocin. He's referred to oxytocin as the hormone, which is the love hormone. And it's very, very interesting that his research has shown that mothers who are given oxytocin, which of course is an induction drug, interferes with oxytocin, and this interferes with the bonding process, and it also interferes with breastfeeding. I think it wouldn't be a bad idea, if you're a mother of an autistic child or a special needs child or a child who's exceptionally hyperactive, for you to do a little bit of your own research into some of his books and textbooks, because I find them to be very invaluable. And they correlate and coincide with all the research that I have also done. Apple Calm is a very important formula in the special needs program because it does help the baby to eliminate these harmful chemicals. It actually stimulates the elimination of chemicals such as aspartame, which is found in medicines, it's found in toothpaste, it's found in sweets, it's found in as a sweetener, and a lot of drinks and water drinks which are low in sugar, slimming foods, etc., etc. It's a permitted chemical and it is extremely dangerous. There are many other chemicals in our environment amongst the additives in our food, and it's for this reason that I would encourage you to avoid all these foods for your children. It's very intriguing that even healthy children, when subjected to a lot of chemically enriched foods and pre-packed and foods with chemicals, preservatives, colorants, etc., etc., cause hyperactivity in children extremely quickly. Even healthy children will become hyper when eating these foods, so they are very important to avoid. Pre-packed biscuits, cakes, buns, sugary foods, all of these foods are very bad for children anyway, but they're particularly dangerous for autistic and special needs children. This formula is calming. It's a very important formula for supporting speech therapy, and we often use this as part of the speech program and the audible program as well. It's very fascinating. We've already discussed the possibility that speech can be impaired by hearing difficulties, and our Cedar Hope, our third formula, is used to support the hearing pathway, the audible pathway. But this is a very important formula for the speech pathway. We find that this formula really works remarkably well in coordination with our special tree formula, which is called Superfit 2 Calm, which is also vibrates on the frequency of ultraviolet. What is so fascinating is that when working with autistic children, we frequently find that a child will choose this formula. They will go to the test kit and they will pick out Apple Calm as their own special requirement. I find that children are extremely clever at instinctive at picking out the formulas that they require. They know what colour they love, they know which formula tastes nice and which it feels right. And the most exciting thing about our program is that because our little essences are very complex essences, are used to coat sugar balls, these little sugar balls are very, very easy to administer. The children love them. The intriguing thing is that they can disseminate between the different vibrations, and they will often reject the vibration that is not right for them and really, really need and want the vibration that is correct. I'm always fascinated by the instinctive nature of little children with regard to healing. It's fascinating and it's something that should be observed. It is interesting that we need to give our children, all children, foods that are very rich in vitamins. And this formula helps to support the uptake of the vitamins such as vitamin C and all the B vitamins, but particularly the vitamin C. So fruits that are sun-ripened, vegetables and vegetable fruits are also extremely good for children. They tremendously need vitamin C. And children who are hyperactive or subjected to a lot of foods that are not vitamin-rich will often suffer with quite serious health problems and slow development problems. You'll find that this formula will encourage children to really progress, and we've often find that after being on this formula for maybe 2 or 3 months, maybe 4 or 5 months even, this formula is often used for longer than the other formulas and is particularly valuable for hyperactivity. This is also very interesting, this formula, because it acts as an antidote to the chemicals in the Ritalin. Often children are controlled, children who are fitting and hyperactive may be controlled with drugs such as Tegretol, Epilim, and of course hyperactive children controlled with Ritalin. It's intriguing that Ritalin is referred to as the chemical kosh by some specialists, and there isn't any doubt that, unfortunately, this drug does increase the levels of hyperactivity when it's not being taken. It's wonderful that these formulas, special care formulas, often help the patient to respond more readily to their drugs on a lower dose. They're more able to wean themselves off. They often find that after a short while of being on the formulas that they don't actually need their drugs. And this is a very important part of our program. Special number 5, Apple Calm, beautiful apples. A is for apple, ABC. Intriguingly, children are taught the alphabet through A, starting with apple. And so this shouldn't come as any surprise that sometimes we start our program with Apple Calm, and then once we've established stability and calm in the child, we then go back to the beginning and start again with the special care formula number 1. If you'd like to know more about this formula, please don't hesitate to contact us.